So I would love to share my screen, but in wonderful technology way. My computer crashed this morning, so I would love to pan around and show you exactly what I'm working with right now. But it's 2021, the evil sister of 2020. My name is Kirk Brown. I am the CEO of Handy. Um, Handy stands for Helping Abused, Neglected, Disadvantaged Youth in Broward County. The organization was formed in 1985 with the intention of filling the gaps for youth that were in care, dependency care, relative care, foster care, and even homeless youth. And it was to provide feel good services for kids that are a part of a system because it becomes so difficult sometimes for a system to really focus on the birthday present, the tie and how to tie a tie, and the bicycle, what color should the bicycle be, really specific services tailored just for the youth. In 2002, Handy made a brave venture to walk into the world of case management and after school programming to address a population that we serve that is three generations of poverty, criminal involvement, and young people in zip codes across Broward County, where only 20 to 27% of the population has a post-secondary degree. And we wanted to do it in a way which is trauma focused and understanding that alongside the extreme poverty that we were seeing comes a lot of trauma and faces of oppression from a macro perspective. So our after school programming is not snacks and tutoring. Okay. It is greater than that. It's focused on the economic mobility of the youth and the family members of the youth that come into our program from a trauma focused perspective, which underlines educational mobility and career pathway strategies tailored with case management services, which means everyone we hire has to have an understanding of the need for economic mobility, not just for the youth, but for the entire family. And also, we use the word love as a part of our program model. Every youth knows we love them. We tell them constantly and consistently. Mr. Cox probably tells them 5 times a day. And an example of that, I think, if I may, Holly, I'm just going to take 20 seconds. On February 13th, right around Valentine's Day weekend, it's a tradition of our organization to show and tell our kids we love them before the wrong people do. Because on our strategic planning chart, we literally have competitors, and our competitors are not other nonprofits. Our competitors are people who navigate in these communities and target these young people for the wrong civil action or the wrong actions altogether. So we realized that one of the points that our young people utilize, Holly, every time they speak of the Handy program, is the family-like structure and the love that they feel from the staff and the program in itself. So on February 13th, we're having something called Just Because. Well, we're bringing our young people into our building in socially distant ways, getting haircuts. They're gonna get their nails done. They're gonna choose whatever color they want, and the guys are gonna get designer suits and shirts, and the young ladies are gonna get dresses also. And then their immediate staff, are actually gonna give them Valentine's Day presents that they have thought about in interaction with a young person. How does that equal an A on an algebra test? Y- You cannot fill my scars with math. You have to address my scars before you can tell me to appreciate algebra. And that is a strategy that has always worked as a part of our program. Mr. Cox, Andre, Cynthia, I hope I represented you well. Sandra and the Children's Services Council want to thank them for taking a risk on us when it was just an idea, which I think grace and hope goes a far way in our industry of social work. And when I say grace as it relates to Handy, it's really taking a risk on us trying something that no one else has ever tried. And it may sound crazy to everybody in the room, but we're like, trust me, we sat 12 kids down and we talked to them about it, and they said it would work. Our programming is also predicated based on the young people telling us what you're thinking will work, not what you're doing, what you're thinking will work, and then we involve them in the strategies for the plan implementation. Any questions? Or Holly, I don't know how this programming usually runs. Thank you for taking me off Super HD. I really appreciate it.
I completely understand. It sometimes can be a little intimidating. Well, at this point, as we normally do, I do want to invite anyone who has questions for Kirk to let me know, to take yourself off mute, and you can ask him directly your questions. The first one I'd like to start with is, this is a statewide group with varying levels of involvement and engagement, from programs on the ground to regionally based to state policy. What are things, anything that you would seek or ask that this type of organization, a group, could do to help programs like yours?
Okay, so Zachary Gibson's on this call also. Hey, Zach, how's it going? So I'm going to start with policy first because Zach and I met from the area of policy. I think one of the things that I see, I would consider after school programming in the communities that we serve an essential and immediate necessary service. So I would like to see this as a federal billable service. If we could walk some of the implementation strategies that we do over to the Medicaid billing structure, or even other federal programs that is billable, to pull down federal dollars in order for us to get a greater level of funding, I think is necessary, because in our program alone, we're doing mental health services. We're having therapists come in. We're doing educational progression, which I know is heavy laden, Zach, in a lot of the federal policies for our state compliance for the dollars that we pull down. So I love to see a lot of our after school programming maybe equal Medicaid billable quotients, or any other federal billable quotient that is necessary from a policy perspective. I think from an implementation perspective, even in a policy area, a lot of our programming are not in schools. They're in nonprofits across and community centers across the community, which bleeds into the ability to access the free food through the SNAP program as it relates, right? And a lot of us are in charter schools, a lot of us are also in private schools, and then that becomes an even heavier journey for us to go through. The other thing for me is, for us at Handy, is the data and the access to the data itself as it relates to the client that we're serving and the family they're in and the zip code that they represent, right? And what impact does that have? So for Handy, last week we ran necessary data. Food costs went up, post-secondary costs went up, housing costs went up. So the child that's in front of us is a micro element that is being fed by a macro barrier, right? So we now have to make sure the staff that is serving this individual is socially aware, but also how definitive data points to say, oh my God, this is what I'm working against. This is why education mobility and career pathways is important, and industry implementation is important. For us, also, we need a bucket of training. We need consistent and continuous training that is, cost effective. One of the things I have to say about the Children's Services Council is that if I think of what we need to be trained in, it's literally already on the list, right? We have that ability to walk over to that training. But in addition to that, I would like to see our frontline be more aware of the Department of Labor accessibility and availability of funding and services for the families that we're served, because the mom who is unemployed, who cares for the kid that's in our program, is directly affected by the 17.8% unemployment rate in our community right now. And so when she's talking to Miss Cynthia or Mr. Cox or Andre, if they're not socially conscious or from a social reinvestment structure for that community aware, they can't point that parent in the right direction and can't make a really good value statement for the community that they serve. So I have a few more, but I'm gonna stop there.
Hi, Holly. This is Zach. Hey, Kurt. How you doing, buddy?
What's going on, man?
Good to see you, man. Congratulations to you and your organization. Thank you for all the work you're doing. It's so good to see you, and I'm, never expected. Let me rephrase that. Your comments do not surprise me. I know you are so focused in on this. What I wanted to share with regards to your presentation is your strategic plan and your identification of competitors, right? Because that's kind of the non-traditional approach that you're utilizing that recognizes the impacts that that has on kids and families. And so I really wanted to compliment you on that. I think you bring up a good point regarding around creative financing and billable items. Certainly, our Medicaid health plans have really looked at various preventative health measures that they could fund. And even in addition, the actual providers have even begun to identify preventative health services that they actually will pay you to take advantage of, right? And for a family that's struggling, that just going to your child's well-being checkup is something that you can earn money towards. So I think, certainly there's the promotion of those type of things that are already happening with additional exploration associated with these other creative financing approaches that you identified. I can tell you I've had some initial discussions at the federal level with regards to some work around children and families. The identification of a dedicated office that's looking at the work amongst all the different agencies, and certainly excited me because part of the role I play here in the governor's office is a very similar approach of looking at the work of all of our agencies to say, how do they connect? How do they align? And how do we further build momentum towards strengthening our program operations and internal business processes that are meaningful for the children and families and vulnerable adults that we serve? So, Kurt, I look forward to continuing this discussion, and certainly am a believer in the power of youth development through out of school time programs that you and others on this call are certainly focused on. And just want to again thank you for the work that you guys are doing.